Ever wondered why full-mouth dental implants sound life-changing, yet secretly terrifying for your wallet? Today we're opening the door everyone tiptoes around. Dr. Esma is here, and we're talking real numbers, real surprises, and the questions nobody asks out loud. If you've Googled this at 2 a.m., stayed confused, and closed the tab, this conversation is for you. Because the cost isn't just the price tag, it's a story.
Exactly, Rasim. Most people think it's one simple number, but it's not. The real cost hides in choices, materials, techniques, timelines. Two patients can hear full mouth implants and walk away with completely different realities. And that's where confusion, fear, and myths creep in.
So if someone's thinking, am I about to overpay, undertreat, or miss something critical, stay right here. By the end, this topic won't feel mysterious anymore. Let's paint a picture. Someone walks into a clinic, hears a single number, and their brain freezes. They leave thinking, is this normal? Am I being upsold? Should I get a second opinion? Or a third? And suddenly full-mouth implants feel less like healthcare and more like a gamble.
I see this every day, Rasim. One clinic quotes a basic approach, another adds bone support, another suggests a faster method. Patients compare numbers without realizing they're comparing entirely different treatments. That's where anxiety starts and trust breaks down.
And online research doesn't help. One article says it's simple, another makes it sound overwhelming. So people pause for years, not because they don't want implants, but because they don't want surprises. This really matters because we're not talking about a gadget you can return. This is your smile, your confidence, your daily comfort. Get it right, and people forget you ever struggled. Get it wrong, and you live with regret every single day. That's a heavy decision.
You're right, Rasim. I've treated patients who rushed and patients who waited too long. The happiest ones understood the process first. For example, someone who chose a tailored plan avoided complications and healed faster. Another who chased the lowest number needed corrections later. Knowledge changes outcomes.
So this isn't just about cost, it's about clarity. When you understand what you're paying for and why, fear drops away. And suddenly, the decision feels empowering, not scary. Dr. Esma, give us some grounding here. People hear full mouth implants and imagine one giant procedure, one chair, one day. But reality is very different, right?
Very different, Mr. Rasim. A full mouth plan can involve several steps over months. In fact, many patients don't realize that healing phases, imaging, and customization make up a big part of the process. For example, one recent patient needed extra support before implants, which added time but prevented future issues.
And here's the surprising part. When people understand that timeline upfront, satisfaction skyrockets. No shock, no stress, just confidence at every step. That's the difference between guessing and going in informed. Alright, Dr. Esma, let's zoom out and put on the science glasses for a second. People assume implants are just fancy screws, but there's serious biology happening under the surface, right?
Exactly, Rasim. Dental implants rely on osseointegration, where bone cells grow and bond directly to the implant. That process determines long-term success. Materials, surface technology, and placement precision all matter. This is why two treatments that look similar on paper can perform very differently over time.
So when people compare prices without comparing science, they're missing the point. The real value shows up years later, when implants feel natural, stable, and forgotten in the best way possible. Okay, Dr. Esma, let's turn confusion into a clear path. If someone is watching right now and thinking, where do I even start? Walk us through it step by step.
First, Rasim, it starts with proper diagnostics, scans, bite analysis, and health history. Second, a personalized plan that matches bone structure and lifestyle. Third, a clear timeline with healing phases explained up front. When patients see the roadmap, fear disappears. They stop guessing and start deciding.
And finally, ongoing follow-up, not just the procedure, but the aftercare. That's where confidence locks in. When you know each step before it happens, the cost feels justified, controlled, and surprisingly manageable. Now let's hit the red flags. Dr. Esma, what should people absolutely pause on before saying yes? Because this is where mistakes get expensive.
Great question, Rasim. First, never rush a plan that feels vague. If timelines, materials, or follow-ups are unclear, that's a warning. Second, avoid comparing treatments only by headline numbers. Cheaper plans often skip critical steps that protect long-term success. And third, don't ignore aftercare. Implants aren't a one-day event. They're a long-term partnership.
So, the real do and don't is simple. To ask questions until things click. Don't let urgency or fear decide for you. The right choice feels calm, informed, and steady, not rushed.